Okay, hello everyone. Today I'm going to discuss a case of mine from Europe who I did a facelift 6 months ago. In fact, it was a total facial rejuvenation. And let's talk about the deformities that I found on her face and what we plan to correct. So let's take a look. The patient had some sagging, a major sagging of the lower face. That's the major part that we have. And when you notice where she's holding her neck down a little bit, you can notice that she has a lot of sagging of the platysmal muscle under her neck, excess skin on the neck, on the lower face, and on the mid-face area. At the same time, you can see here that she has already done a previous lower lid surgery. And the lower lid, still she has under eye bags and a deformity of the lid cheek junction. The plan to correct this facelift, the plan to correct this patient was to do a full facelift with a high smash technique, where you dissect the skin of the face and the neck, and at the same time the temple area, all the way up to the lateral brow, and then you make it flap from this mass, which is a tissue under the skin. It's a pulling up of this mass to raise and lift the mid face, the lower face, and the neck behind the ear. In this way, we will have a more permanent and a much more dynamic and natural looking result. At the same time, I did a temporal lift with a minor brow lift, upper blepharoplasty and lower blepharoplasty to correct this deformity. Meanwhile, she had some depletion of volume in her face, especially on her mid-face, on her chin, and on her temples, and under her eyes, where I put some fat grafting. So now let's go and see the patient. After her 6 months, she's in my office, and we're going to check her scars, listen from her experience about the surgery, and there we go. Okay. And here we have our beautiful patient. Hi. Okay. So here we have our result 6 months after surgery. And as you can see, most of her scars are close to their final shape. However, we expect this to be in her final shape in a year. So she still has another 6 months to go for the facelift scars to be much better. So can I ask you to smile? Okay, and when she's smiling, you can see how natural this dynamics of the lower face and of the mid face are, and her face looks in the correct proportions of a beautiful, aesthetic, and younger face. Okay, so do you want to share with me an experience about this surgery? This surgery was not a small one. It was a combination of facelift, neck lift, temporal lift, eyes, and fat grafting. Yeah. And I think you stayed in Istanbul for a week.
Yes.
Or so.
Yes, I did.
Was it a painful surgery?
No.
It wasn't a painful surgery.
It was not.
Because I usually say that a facelift is not a painful surgery. Some patients, they don't believe in that, but a facelift is not a painful surgery. However, can you tell me the negative parts of this surgery? What was the bad experience you had with this surgery? For example, I think you had too much swelling, as far as I remember, but I want to hear it from you. What are the things that you didn't expect and you had a hard time with?
I think that everything went very smooth. I think it was a great job at the hospital, the nursery.
Nursery, okay.
Yeah, you did a fantastic job.
Oh, thank you.
And you told me, what to expect.
Okay.
So I think the worst part for me was that I was alone on the journey.
Yes.
Because I sometimes needed, even though, the nurses came every three hours to my, as a day and night, very nice. Then I think I needed somebody to take my hand and say, okay, you're good.
So you were a little bit alone.
Yes,
okay.
That was my only
issue.
But it was only about the first four days, because the swelling was most there. So when the shock could be a little, when you look in the mirror and you see you're like totally deformed.
Different, yes.
You think.
Yes.
So you think, oh my God, but it took only
4 days.
Yes.
Okay.
5 days, and then
everything was more into shape.
Yes.
Okay.
So it was good.
Yeah, the swelling usually for facelift we almost have no swelling. However, when we do fat grafting to the face, especially to vast areas of the face, we usually get some swelling, which is maximum between 2 days and 3 days, and then starts to go down after 4 and 5, and that's exactly what she's explaining to us. So let's take a closer look at her scars.
Yes.
So why don't you look on this way, on the other side, and we're gonna look at your scars on your left side. So this is 6 months after surgery. I'm gonna start with the scars that were inside her temple, which I cannot almost find them. She's a very good healing person. She healed very good. This is just 6 months after surgery. In fact, this scar for her sideburn goes all the way from here. And as you can see, a very minor scar here in the preauricular area. I usually do a retrotragal incision, which is going behind this tragus, which is the cartilage in front of the ear. So the scar is in fact somewhere hidden inside here, which is not really visible. The scar goes all the way down here and then back behind her ears, all the way up to this area where it turns back and goes down to the hairline. Maybe you can see a little bit of the scar down here. She's a very good healer. I'm very happy that she healed that good. And that's all the scars that we can see for this total facelift, temporal lift, and neck lift. And she now has a very good contour on her mandibula. You can see on both sides, perfect line. I put a little bit fat on her chin as well to elongate that, to make all the proportions beautifully. And you can see the neck, very tight and very much more, looks much more younger and much more beautiful. She was already so much beautiful. She's now, oh my gosh, she's a princess. Okay, thank you very much.
You're welcome.
And see you next time.
Yeah, thank you.